I'm already getting on Twitter and elsewhere, Jordan, shut the up. Fall in line. Enough criticizing Joe Biden. You're going to reelect Donald Trump. Blah, 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 blah. And you know what? You know what I say to that? I'm not a seasonal journalist. I'm not a seasonal progressive. I don't just turn off my progressive thermometer because the establishment tells me so. I agree, Donald Trump needs to be defeated, but I'm not going to quiet down about Joe Biden's corruption. And if they don't like it, I don't give a shit. Call me whatever you want. Joe Biden is the Titanic, and the Titanic has already hit the iceberg. Joe Biden, as millions of people are already losing their jobs, and because in this up United Corporations of America, those millions of people that are losing their jobs, no fault of their own, because the Chinese, and I'm just keeping it real, decided to have bat soup. That's where coronavirus started, from an animal in China. Or not, it was a bat, right? Yeah. From a bat. They eat bats in China. And I'm not Trump. I'm not calling it the Chinese virus. I'm not being, anti-Chinese. But the bottom line is, this did start in China. Because of what the Chinese did, it spread. And you literally have millions of people losing their jobs, exposing what Bernie Sanders has been talking about for the last 5 years, really for the last 2-3 decades. It is not only inhumane, but it is insane to have healthcare tied to employment. And healthcare should not be a commodity. It should be a human right. Despite this, Joe Biden, as millions lose their health care, he was asked today, do you stand by, being against Medicare for All? Because it sure seems in this particular situation, Medicare for All could really make a big difference here. Let's listen to what Joe Biden had to say.
Because as you've been seeing, our healthcare system seems to be crumbling underneath this crisis. There is not enough. There's not enough support for the healthcare system. There's not enough support for the American people inside of the healthcare system. Are you now reconsidering your position when it comes to single-payer healthcare?
Single payer will not solve that at all. The thing that is needed is, for example, we have a whole number of hospitals that are being so stretched, including rural hospitals, they're going to need more financing. That doesn't come from a single payer system. That comes from the federal government stepping up and dealing with the concerns that they have, the reimbursement that they're going to get, how they're going to be able to move forward, and how they're going to be able to provide all the needed help that are needed in their community.
I don't know. I honestly, I want to be fair here. I don't know if Joe Biden is just severely misinformed, if he's intentionally being obtuse, or if he's just an idiot. But no, single payer would have not stopped the transmission of the virus. But how single payer would solve the majority of this problem? There's several things. First of all, single payer, if people lose their jobs in bulk, and no, he wasn't coherent. If people lost their jobs in bulk like this, whether it be through a pandemic, when the climate crisis or the inferno hits us all, it's coming, there would be a government safety net. So people would lose their jobs, but they would still have their health care. Right now, people are losing their jobs, and they have the additional stress of not having health care. So what happens when those workers lose their job? Most cases, your health care is discontinued right away, and you have to go to the emergency room because you get coronavirus. Well, your health care has lapsed. Most cases, it doesn't hang around for 3 months after you lose your job. Joe Biden says, oh no, coronavirus treatment, that testing will be free. Treatment will be free. That's what he said. But as far as I could tell, there hasn't been any legislation to make coronavirus testing free or the treatment free. So how is it then that Medicare for All would not solve this? At least if you lost your job already, if you got laid off, if you got furloughed, whatever, and you don't have health insurance effective that day, if you have to go to the emergency room, not only are you sick, but you have just lost your job, your income, and you're going to get hit with, if you're lucky, $1,000 bill, probably more. Medicare for All wouldn't help this, Joe Biden says. You have the government has to step in and help the hospitals who are overrun. It's the government who will have to step in and help the hospitals that are overrun, not single payer. Does he not understand that single payer is the government stepping in? I mean, I don't understand this man. I really don't. Does he not understand that what we're talking about here, Medicare for All, is the government stepping in? I don't really get how this man doesn't understand this. He's literally saying, no, single payer won't solve this. We need the government to step in and provide more funding to the hospitals, provide more funding to rural hospitals, this and that. A Medicare for All system has that at its base. A Medicare for All system is the overall distributor and payment system for the hospitals, for the doctors, for communities. It's not complicated. But Joe Biden is talking nonsensically, and I'm sorry I can't play the clip. I don't really know what's going on. I have a little lag here. But Joe Biden is continually, and on MSNBC during this interview, saying, no, single payer won't stop that. It's the government that needs to step in. It's the government that needs to provide more funding to the hospitals. I just think he's being intellectually dishonest, because that's what Medicare for All is. It is a government system to provide funding for healthcare, for the doctors, for the nurses, for the dentists, for the mental health, for the hospitals, both in urban and in cities. And Joe Biden, of course, knows this. So I don't particularly know what does Joe Biden think is the difference between government stepping in as the last resort in a pandemic and government being the main go-to all the time for healthcare. If you're saying that the government will step in and provide more funding to the hospitals, then why is it that the government can't just do that, period? Because I really hope, and I just tweeted this earlier, I really, really hope we're done with the how you're going to pay for this bullshit. Because the government, they just figured out with the snap of their fingers how to pay for a $6 trillion corporate bailout. Let me repeat that. A $6 trillion corporate bailout. Snap of the finger. There was no problem. We already know Alan Greenspan at the Federal Reserve, Ben Bernanke of the Federal Reserve back in the day said, oh, no, Social Security will never actually go out because the government could just create more money for it. Remember Ben Bernanke, 60 Minutes, said, oh, no, the debt, we just move a decimal and we create the money digitally in a system. So it's never, this whole how you going to pay for it thing has always just been gaslighting on a mass level. How you going to pay for it is not a real thing because we have the money to pay for all of these things. The problem is there's nobody stopping us from paying for it. You know what's stopping us from paying for it? Joe Biden's donors. The Wall Street banks, the pharmaceutical companies, the healthcare industry, who don't want Medicare for All. Because if we get Medicare for All, then their yachts, their country club memberships, their millions and millions of dollars in executive compensation, profits, in deductibles, copays, and all these things that should not exist go away. And that MSNBC anchor, and I'm sorry, I don't know why the clip isn't working, that anchor who asked him, why not Medicare for All, should have challenged him and said, well, if you're saying that single payer wouldn't do anything about this, how can that be? Millions of people just lost their health insurance because their health insurance is tied to their jobs. Wouldn't they have health insurance now if we had a Medicare for All system? What about the fact that you're saying, oh, the government would step in and help fund the hospitals? Well, if you're saying the government could step in and fund the hospitals, why can't the government step in and provide health care year-round? What's the difference? Hope you enjoyed that last video. Hop on over to statuscoup.com where you can sign up for our email list and become a member for as low as $5 to $10 a month. Membership is how we grow. That's statuscoup.com/join. And remember, join our email list so we can grow the revolution with you.